Hello, I'm Dr. E. Barry Gordon, and this is my 19th video about the disease testosterone deficiency. I've changed the order of the videos a bit. This and the next will be about the most important women's health issue of our time, breast cancer. And then we'll get into videos 17 and 18 about diabetes. Few things in medicine have been more confusing and controversial than the relationship between the hormones produced by the ovaries and breast cancer. I presented my view of standard hormone replacement therapy, meaning the replacement of the female hormones estrogen and progesterone in postmenopausal women, in video 9 of this series. Today I'm going to present the case for my belief that a progressive deficiency of testosterone is a primary underlying cause of breast cancer. As in prior videos, I'm going to change the wording of some of the studies I quote to make them more easily understood. The unaltered abstracts are on my website, www.thehiddendisease.com. Also, I want to make it very clear at the outset that I am not an expert on breast cancer, and I have not done any new research on the subject. What I have done is three things. I've put some deeper thought into currently accepted medical beliefs that have never made any sense to me. I've taken a step back to see if there was any related medical knowledge that might shed some light on the puzzle, and I've taken a look at what some of the less publicized medical literature has to say on the subject. Any discussion of breast cancer has to include the subject of female hormone replacement, giving a postmenopausal woman estrogen and progesterone, because it is fairly well proven that female hormone replacement does increase the risk of breast cancer. I've always had a problem believing that the mere presence of adequate levels of estrogen and progesterone, which just a few years earlier were a vital component of a woman's good health, would suddenly one day turn into a cause of cancer. Having said that, as you will see, I realized that giving postmenopausal women these two hormones should lead to increased rates of breast cancer. And now I understand why. It's important to keep in mind that this long-debated female hormone replacement issue does not involve the many women who get breast cancer before they reach their menopause. Female hormone replacement certainly has nothing to do with their cancers. Questions about the causes of breast cancer, therefore, must include female hormone replacement, but go well beyond that issue. A more fundamental and non-controversial fact about breast cancer is that the older the woman, the more likely the breast cancer. In other words, as women age and their female hormone levels continue to fall, their risk of getting breast cancer rises. So let's look closely at the current situation. Medical research has proven that decreasing female hormone levels due to age and increasing female hormone levels due to replacement both predispose to breast cancer. Doesn't it sound like there's something wrong here? Doesn't it seem likely that there's something else involved, something that's common to both age-related female hormone loss and replaced female hormone increase? There is a condition that explains this dichotomy perfectly: testosterone deficiency. I'm convinced that the absence of sufficient testosterone in the presence of estrogen and progesterone is a primary or the primary cause of breast cancer. Let's look at the facts, starting with women who never take female hormone replacement. It is well established that women begin to lose testosterone between the ages of 25 and 35. Let's call 30 the average age. The average age for menopause is 51, a 20-year difference. It might be argued that female hormone levels begin to decline before the actual end of menstruation, but we certainly have at least a 10 to 15 year span between the beginning of the loss of testosterone and the beginning of the loss of the female hormones estrogen and progesterone. During this decade plus, these premenopausal women obviously have adequate amounts of estrogen and progesterone, but certainly less than adequate amounts of testosterone. It has been repeatedly proven that estrogen and progesterone, in the absence of sufficient testosterone, are irritating to breast tissue. I'm going to repeat that. It has been repeatedly proven that estrogen and progesterone, in the absence of sufficient testosterone, are irritating to breast tissue. 2 studies on this issue were done by the National Institute of Health. They were published together in the July-August 2003 issue of the journal Menopause. The National Institute of Health scientists were investigating some prior evidence that estrogen can irritate breast tissue and that testosterone normally acts to prevent this estrogen effect, and that testosterone, quote, thereby may protect against breast cancer, close quote. That's the National Institute of Health 5 years ago. In the first study, they deprived female monkeys of testosterone and found a doubling of breast cell activity, quote, indicating that testosterone normally inhibits excessive breast cell activity, close quote. Is it just a coincidence that the incidence of breast cancer starts to rise rapidly around the age of 40, an age when women have their full quantities of estrogen and progesterone but have been losing testosterone for about 10 years? I think not. Is it just a coincidence that women start to get breast cancer at the same age they begin to suffer the early symptoms of testosterone deficiency? I think not. How does this finding of breast irritation from the lack of testosterone fit in with the risk of breast cancer increasing in women as they grow older? As we've seen, the loss of testosterone in women begins at a much earlier age than the loss of their female hormones, creating a 10 to 15 year span between the onset of symptoms of these deficiencies. It's also obvious that the effects of testosterone loss, such as weakness, fatigue, osteoporosis, become progressively more severe as women age. So it takes no great leap of intellect to presume that another effect of testosterone loss, namely breast irritation, also progressively becomes worse as women age, leading to an ever-increasing risk of breast cancer. Let's turn our attention to the female hormone testosterone gap in postmenopausal women who take female hormone replacement. As I explained in detail in video 5, the brain of a postmenopausal human female is having a violent reaction to the failure of her ovaries. Her brain has directed her pituitary gland to stimulate her failing ovaries as much as is biologically possible. This is basic physiology. As a result, these ovaries still do produce some estrogen, some progesterone, and some testosterone, but certainly not enough to be vigorous, energetic, and sexual. In other words, not enough to be healthy. Now the woman decides to go on female hormone replacement. She begins taking a pill or a patch with estrogen and progesterone. What happens? Her brain and pituitary, sensing renewed adequate levels of these 2 hormones, stop driving her ovaries so hard, and her testosterone levels fall to essentially nothing, leaving an enormous gap between her female hormone levels and her testosterone level. The second National Institute of Health study duplicated this situation. Female monkeys, postmenopausal because they were without ovaries, were treated with either estrogen and progesterone or with estrogen, progesterone, and testosterone. What did they find? Quote, we show that addition of a small physiologic dose of testosterone to standard estrogen therapy almost completely attenuates estrogen-induced increases in breast cell activity, suggesting that the increased breast cancer risk associated with estrogen treatment could be reduced by testosterone supplementation. And quote, these findings suggest that treatment with a balanced formulation including all ovarian hormones may prevent or reduce estrogenic cancer risk in the treatment of girls and women with ovarian failure. Close quote. A more recent study, this one done on human breasts, also duplicated the female hormone replacement situation. It was done at the Karolinska University Hospital in Stockholm, Sweden, and was published in April 2007. The study report began with the following, quote, "During the past few years, serious concern has been raised about the safety of combined estrogen-progesterone hormone therapy, in particular about its effects on the breast. Several observations suggest that testosterone may counteract the stimulating effects of estrogen and progesterone in the mammary gland." Close quote. In their study, they first biopsied women's breasts to establish a baseline of cellular activity. Then they did the same as the National Institute of Health had done. They gave one group of women estrogen and progesterone, and the other group estrogen, progesterone, and testosterone. After 6 months, repeat breast biopsies showed that the breasts of the women who received only the female hormones were highly stimulated, but there was no change at all in the breast tissue of the women who had also received testosterone. Quote, "In the group not given testosterone, there was a more than 5-fold increase in total breast cell activity from baseline. During testosterone addition, no significant increase was recorded." Close quote. So far, we've seen that 2 of the greatest known risks for women to get breast cancer are associated with the exact opposite changes in their female hormone levels. So how can female hormones possibly be a primary factor? On the other hand, not only are age and female hormone replacement both associated with a widening gap between female hormone levels and testosterone, but 3 biopsy studies have shown that the female hormone testosterone gap is highly irritating to breast tissue. How do these findings fit in with other recognized risk factors for breast cancer besides age and female hormone replacement? A younger age of onset of the menstrual cycle identifies women at greater risk of getting breast cancer. These women very well might do everything at a younger age, including losing their testosterone. An older age of menopause also slightly increases the risk of breast cancer. Logically, it should. They're having a prolonged higher quantities of estrogen and progesterone in the face of falling testosterone levels. The Mayo Clinic website states that use of birth control pills is associated with an increased risk of breast cancer in premenopausal women. A significant decrease in testosterone is an inescapable consequence of taking birth control pills. If testosterone levels didn't fall, the pills wouldn't be working. There are also what are called modifiable risk factors for getting breast cancer. These include being overweight, being inactive, and excessive alcohol consumption. I believe the association of breast cancer with being overweight exists, but I find it hard to imagine a woman not getting breast cancer simply because she loses 20 or 30 pounds. It seems kind of silly. In regard to exercise, one study reportedly found that just a couple of hours of brisk walking a week reduced the risk of breast cancer by 18%. Does anyone really believe that a 2-hour walk once a week will prevent a woman from getting breast cancer? The association of obesity and inactivity with breast cancer exists because they all have the same underlying cause, testosterone deficiency. In video 12, I explained that among the most common early symptoms of testosterone deficiency are increasing abdominal fat, lack of energy, and lethargy. So obviously these 2 findings would frequently accompany breast cancer. In addition, because testosterone deficiency also promotes depression, anxiety, loss of sexuality, and a poor sense of self-esteem, I strongly suspect that the hormone deficiency is often an important underlying contributor to alcoholism. There'll be more on this in a future video. When it comes to the relationship between the hormones produced by the ovaries and the risk of breast cancer, the so-called female hormones, estrogen and progesterone, get essentially all the attention, despite the fact that when it comes to getting breast cancer, it makes little difference whether a woman still has younger, adequate levels of these 2 hormones or has been losing them for decades. To make any connection even less plausible, after the menopause, the risk of getting breast cancer increases whether the levels of estrogen and progesterone go up or go down. In stark contrast, not only is breast cancer uncommon or even rare in women who have adequate quantities of the third ovarian hormone, testosterone, but the more of this hormone that is lost during a woman's life, the greater her risk of getting breast cancer. Every circumstance known or widely believed to promote breast cancer, with the possible exception of genetics, points a huge flashing arrow at testosterone deficiency. And on top of this, 3 studies have proven by breast biopsies that the absence of testosterone is highly irritating to breast tissue. What more do we need to focus in on this connection? How long are we going to let women continue to get yet another horrible disease and suffer and die because of the closed minds of the medical establishment? My next video is also going to be about breast cancer, but this time about the belief held by some in the medical community who have the exact opposite opinion, that replacing testosterone increases the risk of breast cancer. Wow. Watch it, so that if you ever hear such an opinion, you'll know the facts. As always, I ask that you help me spread the word about the existence of this disease and the existence of these videos, so everyone has the opportunity to make an informed decision about their testosterone health. I'm Dr. E. Barry Gordon. Thank you for watching.